In this video, we are going to talk about Healthcare USA versus Canada. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. Healthcare reform is a hot topic in the United States and most of the rest of the world. By contrast the US health system with those of other countries, we can gain a better understanding of the options available. The Canadian healthcare system, in particular. We may help clear up ambiguities and make our options clearer by comparing the US and Canadian healthcare systems. Although some people believe that Canadians get free healthcare, Canadians pay for it through taxes. Patients in the United States are more likely to pay for healthcare using premiums or copays. There is no such thing as free healthcare. Economists analyze the costs of healthcare in Canada and the United States to determine how much the average patient in each nation pays. The healthcare system in Canada. There are more similarities than differences between the US and Canadian healthcare systems. According to the World Health Organization, both countries are ranked quite well in worldwide polls of healthcare quality, WHO. Both countries have lengthy life expectancies and are relatively prosperous in comparison to much of the rest of the globe. However, life expectancy in Canada is slightly higher. Health insurance is paid for by the federal government in Canada. The majority of services provided by a hospital or a general practitioner's office are covered by government insurance. According to the National Center for Biotechnology Information, NCBI, commercial insurance coverage of government-funded therapies is technically forbidden in Canada. Canadian healthcare is a single-payer system. The Canada Health Act of 1984 established the Canadian healthcare system. The Government of Canada offers healthcare insurance, but it does not operate hospitals or directly employ doctors. Providers are directly employed by the government in the United Kingdom, whereas they are privately employed in Canada. Doctors work on their own, yet they must meet insurance standards in order to be reimbursed. Citizens in Canada can and do purchase private health insurance for certain services under the Canadian healthcare system. Dental and aesthetic services, for example, are not covered by government insurance. There are some small coverage discrepancies across Canadian provinces, which are analogous to states in the United States. One of the most significant distinctions between healthcare in Canada and the United States is the amount of money a patient pays at the time of treatment. Most Canadians pay for healthcare through taxes. Higher earnings are taxed at a greater rate. In practice, this means that high-income individuals pay more for healthcare than low-income individuals. Canada's costs per person are lower in part due to the government's stronger negotiating stance. In negotiating pricing arrangements with drug firms, for example, the Canadian government has more negotiation power than any commercial insurance. The American healthcare system. Nearly half of Americans acquire insurance through their employment. This private insurance is typically funded by a combination of company and employee contributions. Private insurance costs and coverage differ by state and employment. Medicaid provides health insurance to the poorest Americans. Medicare provides insurance to seniors. However, many working-class people do not qualify for government insurance, and many jobs do not offer health insurance as a perk. As a result, many people in the United States were unable to buy private insurance. Even after the Affordable Care Act, millions of Americans remain uninsured. Americans pay more for healthcare, but they may also face unanticipated or unexpected costs. There are numerous private insurers, each with its own set of reimbursement standards. Copays and deductibles differ significantly. Patients may incur substantial out-of-pocket payments for emergency care or due to circumstances beyond their control. According to the Federal Reserve, the U.S. healthcare system is a primary cause of bankruptcy. The differences in the systems. Apart from insurance, there are a few more distinctions between US and Canadian healthcare. In Canada, there are more general practitioners per capita than in the United States. According to the NCBI, GPs account for around half of all doctors in Canada. According to the Agency for Healthcare Research and Quality, just approximately a third of doctors in the United States are general practitioners. To see a specialist for non-urgent care, Canadians usually need a referral from their primary care physician. If a specialist doctor in Canada sees a patient without a referral from a general practitioner, they face financial penalties. Wait times for specialized services in Canada are generally greater than in the United States, in part due to this referral need. If a Canadian needs emergency care, they get it right away, but the NCBI says that for other services, such as knee or eye replacement, Canadians have to wait weeks longer than Americans. Healthcare in Canada versus the United States boils down to distinct options. Canadians provide health insurance to everyone, but they keep prices down by limiting the number of experts available, which can contribute to longer wait times. The wait may be shorter in the United States, but the patient usually pays more. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.